Hi, I'm Dr. Rajani. Thanks for joining me today. Could there be a single vitamin that's killing your skin? Just one element that you may be missing that's leading to aging? One that can reverse the signs of aging or at least can prevent them from occurring in the future? The good news is this one does both according to the studies, and I'm going to talk to you about those today. And this will be one of the few supplements I'll ever recommend for people. Normally, I'm all about incorporating it into a healthy diet, but not this time. Let's explore. So why wouldn't you be eating it and getting it normally? Why would you have to go seek this out? It's found in rare foods, so if you're not supplementing, you may end up needing to consciously take it in. It's not found in things we normally eat. In fact, many of my younger patients are noticing early wrinkles, fine lines, and they're not sure why this is happening. It's kind of a new phenomenon. People are walking in the door at a younger and younger age with lines, wrinkles, and folds. Essentially, patients come in and at 35, they're looking much older. Notice I said the word old and I didn't say tired. I talk about that a lot, and I'd like you to go back and look at my videos after this on old versus tired. There's a big difference there. Old is typically, we're talking about what? Bone structure. When you see someone, you haven't seen them in years, and maybe 3, 4, 5 years, and you look at them, you go, they just look old. And I don't mean that in a bad way. You're calculating that they look old. That's typically bone. When someone looks tired, it can be under eye fat pads, it's loss of fat in the face. Sometimes runners and cyclists can look old because they're losing some of the superficial fat in the skin. So that's a distinction to take note of, and I'll expand on that in a moment. The vitamin I'm talking about is called K2, and it helps to put calcium right where it is needed, and that's a key function here. It works in a really cool way by regulating the actual distribution of the calcium, and of course calcium is found in bone. We now know that it's needed in the face for preventing wrinkles, and distribution is key. Why might you say it's key? Remember, bone builds up when it sees resistance. So the head, unfortunately, is on a bobble, so it has a shock absorber built in. Your hip, your knees, they're seeing resistance, and the body says, build bone up. For the head, we have a built-in shock absorber. We get osteoporosis in the face, which a lot of my viewers are like, really, that happens? Yeah, it does. And because there's no resistance, the body doesn't know to build bone. So a lot of this is genetically modulated, and so it's important with this one element, it actually distributes the calcium, and so it will actually help the face. Look in this diagram to see where K1 lives versus K2. People know K1 from clotting disorders, and those who are on blood thinners, they're often told not to take vitamin K. Not K2, it helps the whole body. K1 is more involved in clotting, and if people are on anticoagulants or blood thinners for one reason or another, history of stroke or DVTs, they're told not to take green leafy vegetables. That's K1. The distinction here is this is K2. This vitamin K2 is best taken in one form, and I'll get to that later. I'll tell you exactly where you can get it and the single best food source. In 2011, endocrine researchers in Boston found that women aged 40 to 50 had extensive wrinkling and were also found to have low bone mass. In fact, it didn't even matter about their body mass index or their weight, it was just their bone index was low, BMD, or bone mineral density. Every single bone tested was deficient regardless of this BMI and regardless of age. Now, it's no secret, of course, take the Japanese. They're known for beautiful skin into their 80s. If you've ever been there, you walk around the streets, they look great. It's hard to tell how old anyone is. Researchers studied why this was the case. They even studied those moving around Asia and those who moved from Asia and Japan to North America. When they moved, their skin didn't move with them. They aged more. That's what I mean by their skin didn't move with them. The protective benefits were gone, and that was studied. Why? Why did that happen? They looked at their diet. There's something called natto. It's a dish eaten in Tokyo It's from fermented soybeans. It's often eaten in the morning for breakfast. It's a beloved Japanese dish, and you don't really see it anywhere else. It's made from fermented soybeans that are usually not found in the US and certainly not in the grocery stores. Partly, it's strong, it's pungent, it's like dirty socks. I've had it, but powerful health benefits are found within, so you're kind of eating it and you're going, well, this is good for me. Kind of like when I was a kid, cod liver fish oil my mom used to give us. This natto helps with skin, teeth, cardiovascular disease, and it's even being studied for anti-cancer uses. It's very high in K2, and that's correlated with skin, great skin in the studies. Low vitamin K2, noted as a deficiency, has conversely been noted for poor skin. So when you look at people who just get this K2, their skin looks great. If you don't, the skin quality is decreased by observer studies. So what about soy? A lot of people are going to say, hey, if it's a fermented product, what about soy? Could that work? The soy is high in isoflavones, but not so fast. Let me show you a quick study. So there's many studies, but here's one from the Nutritional Epidemiology. And what we're looking at here is Japanese fermented soybeans, or natto. As I said, they contain a large amount of metaquinone 7, which may help prevent the development of osteoporosis. They assess the possibility and an association with the habitual natto intake and bone mineral density in healthy Japanese women. Oftentimes we're studying women here because they're the ones who get osteoporosis more than men. And they participated in this large study. There were significant positive association between natto intake and the rates of changes in BMD at the femoral neck and the distal third of the radius. Most commonly, that's where we look at it, in post-menopausal women. Now, typically estrogen plays a big role here. I know many people are on estrogen bioidentical hormones, and that does play a big role if in an appropriate patient who can take those and has the family history where they're allowed, or where it is less dangerous, I'll say. The Nurses Initiative study is one to look at if you're interested in estrogens. The association in the femoral neck persisted even after adjusting for the covariance. No significant association was observed between the intake of tofu or other soybean products, and that's key. And I want to show you, let's pop down, I want to show you where they talk about that, because a lot of people here do take soy, and there's a lot of discussion about soy and can it mediate estrogens. A lot of people are scared to give it to young boys, thinking they're estrogenized. There's certainly something in our food, I believe, that's affecting our kids. The body habits, particularly of young girls, I'm thinking from the age of 10 to 16, 18, has changed. And something's going on with the food supply. I'm always looking at that. But look here, pertinent to this, isoflavones also may be effective components of the natto. So we're trying to figure, we always like to know what in there is making the difference. It contains a large amount of isoflavones, which were reported to reduce bone resorption through estrogenic mechanisms. There it is. One portion of tofu also contains an amount of isoflavones similar to that in one pack of natto. And here's the kicker. However, tofu intake was not associated with bone loss prevention, so it didn't work. This may be due to the difference in the type of isoflavones present in natto and tofu. So there are differences, and when I talk about, I know we're doing a little bit more in nutrition, it's oh so important. Because what I'm finding is you guys want your procedures to last longer, you just overall want to look better, so we have to cover these things. But it's in depth. It's very difficult to tell. But here you can obviously see this is within a study that some foods work and some don't. We don't always know exactly the component. We're guesstimating. We're very early in all of this anti-aging and studying. If you don't think we are, just go to the A4M. It's a conference in Vegas, the one I typically go to in December. Didn't happen this year, unfortunately. I really missed it. But they go through all of this stuff. and bioidentical hormones and everything. I encourage you to study it if you want. We're very, very early. We're learning about it. But there you go for those asking about tofu, because I know a lot of people will. So we know natto is a good source. Where else would it come from in maybe our diet? Fermented dairy products, eggs, liver, and in North America, a lot of people do eat goose liver, believe it or not, but it is high in K2, brie cheese, again, fermented dairy, egg yolk, and real organic butter. So those are some sources that are high in it. I put a playlist up here on things you can do for healthy skin. I want you to watch that and go back and watch my video on old versus tired. It's a big distinction, but bone plays a big role in people's aging and how they look. Are you taking K2? Love to hear from you in the comments below. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.